Hey guys, it's Lynn from Tunamics, and today I wanted to talk to you a little bit about lateral knee pain and how you can address that as a therapist. So if we think about the structures of the lateral knee, we've got peroneal muscles coming up here, we've got an IT band, some quads, we've got a lateral hamstring that comes around, and that all kind of morphs up into our hip flexors. So if we think about this, people get lateral meniscus issues or tears and all kinds of problem there. Well, what is the big thing that usually causes that? So if we think about this real generally, usually those injuries are going to occur when somebody's going sideways, right into a little bit of a frontal plane or lateral move, or they're going into rotation. And rotation is typically what causes the most issues. So if we think about these structures, how the peroneals come up here in the lower leg, right? So if I'm going to go into right rotation with my body, say somebody I was playing basketball and somebody came to the right or threw me a pass and I go to catch it, if my knee is rotating to the right and also kind of coming into a little bit of a flexion pattern, those peroneal muscles have to be really, really flexible so that they can eccentrically load and decelerate that motion. Now, it's really common, most people's lower legs are really tight because everything we walk on is pretty flat, especially in America or Florida where we're at, there's just not much elevation and everything inside is flat, so the muscles never really get worked that much. So a lot of times they're really locked down or already extended as much as they can, so if I'm going into a side rotation motion, all of their slack's pretty much taken up. And since, we always talk about knee issues, almost every time are going to come with problems in the ankle or the hip. So we think about the ankle, how does the ankle attach to the knee? Well, it's a lot of like the tibialis anterior and a lot of the peroneal muscles. So if there's tension in here and they can absorb that motion and decelerate it, that puts the pressure on the knee. Now we can also move up a little bit forward here. We think about the quad muscles that come in here and the IT band and the lateral hamstring. Now the IT band attaches down here, but you guys have heard my rants on the IT band, a lot. Yes, it attaches there. Yes, people get sore there, but I am not a fan of foam rolling it and rarely massaging or working on it because if it's having an issue, right, it's just a chunk of tissue. It doesn't contract. It is a place for all the glutes and all these other muscles to kind of tie in into and work with. So if it's having an issue, it's because somebody else in the body isn't doing their job. So if I think about that, if I'm going laterally, then I can even think about the oblique muscles a little bit, but more so, the lateral quad muscles are going to have to lengthen and load when I go into internal rotation on this leg. But mostly it's the glutes, right? Because the glutes are going to come down from the sacrum and coming attached out here to the outside of the femur head, and then we've got the hip flexors here. All of that has to decelerate frontal plane motion and rotation off at the same time. So if your glutes are not flexible and people don't have the coordination to go into internal rotation with flexion, then that's going to set up this lateral knee for failure really, really quickly, because if I can't absorb that force with my glutes in rotation and then my peroneals can't do that, what's going to take the hit? It's going to be the lateral knee. So if you do have somebody that's a little bit injured in there and you go release all these tissues, with structural type fascial work and clear that out and all the way up to the glutes, and typically you'll do both sides over your treatment, but if you just have an hour the first time, you're going to do the main side. That's going to take a lot of that torque out of there. And this is a real big generality. Of course, you're going to work with like the lateral gastroc heads and a lot of the other tissues that are going to keep, accelerating that or decelerating that motion, and it comes in to protect the knee. You're going to look at that because there's a lot of factors, but overall, if you just go in and release the lateral parts of the leg and the glutes and a little bit of the obliques, most of the issues in the knee is going to clear up. It can be more complex than that, but that's about 80% of what you're going to find, and the issues that you'll get there to clear up that pain and get it to heal up is going to be exactly what we showed you today. So I hope that helps you guys out in understanding kind of the causes of lateral knee pain and how you can address that. Also, you can look at some of the exercises, you guys that are taking our classes, how we show you how to get the glutes to to turn on and work in the right way in rotation and transverse plane motion, which is, you know, usually why this starts anyway. Hope to see you guys in a class there. If not, we'd love to see you on the Massage Pro Think Tank on Facebook, or go to tunamics.com and you guys can see where we'll be teaching in your area next. We'd love to see you in person and come on in. Otherwise, please subscribe to our YouTube channel where we have tons of great tips and hints that you could use just like this. Thanks.